Juan Carlos is a 39-year-old male who's had a facial melanoma resection and an additional scar correction surgery. You can see that he presents with a very significant and noticeable depression on the right side of his face, caused by a loss of volume and by the retraction caused by the scar. I think Juan Carlos is a good candidate for BEAUTYFILL, plus a second treatment with reabsorbable threads on the opposite side of his face to restore symmetry. Since this is a zone where the soft tissue has no immediate bone support, I'm going to use the blue marker. I mark out a rhomboidal zone in which we're going to need to add volume in order to restore the symmetry and harmony of Juan Carlos's facial features. If you imagine the previous resection zone from his earlier melanoma surgery, this rhomboid is more or less what you would see. I come in at a 90-degree angle with an 18G needle. As you've noticed, I'm sure, I use the fan technique quite often because it's the one that works best for me. But really, I end up using mixed techniques because a combination of several fans a lot of the time results in a nice cross-hatching technique. We still need to fill a little more in a longitudinal direction towards the middle of the scar, because that's the zone where the loss of volume is most prominent. Now, the scar area is thinner than the rest because it doesn't have all the layers of dermis anymore. Well, we can already see significant improvement, but Juan Carlos has another depression over here we still need to fix. And here we're going to inject just a little bit using a 21G needle. The total amount of BEAUTYFILL injected was 3 milliliters. The alternative procedure for correcting Juan Carlos' depression would have been facial surgery or lipo injections. Lipo injections involve performing abdominal liposuction to obtain 50 to 60 cc's of fat, and the proper preparation of it using Coleman's technique, and then the injection into the receptor zone. But I spent only 15 minutes on this procedure, but lipo injections would have taken me 2 sessions of 45 minutes each, and obviously more inconvenience for the patient. So total time of injection, 15 minutes versus 90 minutes with lipo injections. I like to prescribe a non-steroid anti-inflammatory to my patients for about 2 or 3 days, preferably a COX-2 selective inhibitor.